Hey guys, it's Libby, and I had somebody request that I make a video talking about the different levels of eating disorder treatment. And eating disorders are my thing, so I was like, yes, I will do that. So here I am to do just that. Let's do it. While eating disorders are my thing, I am not yet an expert on them and their treatment. So I did do some research to pull together this video for you. The research I got mainly comes from the American Psychiatric Association's standards for treating eating disorders. So yeah. So we're going to start at the lowest level of treatment and work our way up to the highest. So the lowest level of treatment is just regular outpatient treatment. Everybody's outpatient care looks different, but an example of what it might look like could be seeing a therapist weekly, seeing a psychiatrist every few months, and then seeing a nutritionist every month or as needed. Some people also seek social work or spiritual guidance as well. In order to be treated at this level of treatment, you must be medically stable. That means that you don't need to be monitored frequently. In order to do outpatient, you need to have fair to good motivation to recover. Ideally, you would also be getting adequate support at home. You're self-sufficient in your eating and you're gaining weight. You're able to manage the urge or compulsion to exercise and purge. You're at no imminent risk for suicide. In order to be seen at this lowest level of care, you must be medically stable, which means you don't need to be monitored frequently, like your heart rate and all that stuff. The next level up in care is intensive outpatient, or IOP. This is a type of program that you would attend a few days a week for just a few hours at a time. I've even seen this offered virtually, so if you don't have an eating disorder treatment program near you, there might be an online program that could meet this level of care for you. But an example of what this could look like would be going to program 3 days a week for 3 hours at a time, so like 9 hours a week. Usually in these programs, you'll spend time attending individual therapy and group therapy or like psychoeducational groups. And you'll likely also see a nutritionist or dietitian and a psychiatrist. Family therapy is really common for treating minors with eating disorders. That's something I didn't mention in the last tier, but it is something that happens quite frequently with minors. But anyways, in an intensive outpatient program, you might share a meal and or a snack while you are at the treatment center. In order to qualify for this level of treatment, you must be medically stable, again, meaning you don't need frequent monitoring. You must have fair motivation to recover and adequate support at home. You may need some support when it comes to not compulsively exercising and or purging, but you do have some like inside of you kind of motivation. However, you are self-sufficient with eating and gaining weight. With this level as well, you must be at no imminent risk for suicide. Generally speaking, to be at this level of care, you're at 80% or above of your ideal healthy body weight. Moving up to the next tier would be partial hospitalization program, or PHP. PHP is at least 5 days a week, 6 to 11-ish hours a day. So basically, you go there, you spend all day there, and then you go sleep at home. In a PHP program, you would be attending individual therapy, group therapy, psychoeducational groups. You'd be meeting with a nutritionist and a psychiatrist and maybe a social worker. And again, family therapy might be incorporated. At this program, you will spend your entire day there, and then you just go and sleep at home, and then you come back. So most, if not all, of your meals and snacks will be there at the center. They will be monitored. They will be regulated according to your specific meal plan. When I went to PHP, I had all my meals and snacks except for my evening snack, which when I got home, I had my evening snack by myself at home, and then go to sleep, go back the next day. At my PHP program, the bathroom was also regulated after mealtime. Like, we couldn't go for, I think, 30 minutes after a meal or snack. And like I said, this program is usually daily, although some programs will skip weekends. In order to qualify for this level of care, again, you must be medically stable. You likely have partial motivation to recover, and you don't necessarily have all the support you need at home. Additionally, you'll likely need some support and structure with eating and gaining weight, as well as support around not purging and not exercising. Again, though, with this level of care, you're at no imminent risk for suicide. And typically, these people are at 80% or above of their ideal healthy body weight. But now let's discuss the second highest level of treatment, which is residential treatment. With residential treatment, you reside there, you live there. So it is 24-hour a day, all day, every day treatment. In a residential program, you'll spend your days attending individual therapy, group therapy, psychoeducational groups. You'll see a nutritionist or a dietitian. You'll see a psychiatrist. You might see a social worker. And again, family therapy is common for minors. Because you'll be spending all day, every day there, you will have all of your meals and snacks monitored. Additionally, they'll be monitoring your behaviors at other times to prevent purging and exercising. In order to attend residential treatment, according to the American Psychiatric Association, you must be medically stable to the extent that intravenous fluids, nasogastric tube feedings, or multiple daily laboratory tests are not needed. So you might be somewhat medically unstable, but those super acute, critical medical needs are not present. In residential treatment, it's not uncommon to have only fair or even poor motivation to recover. And additionally, it's not uncommon that you won't have the support you need at home, which is why you're not home. You're at a residential center. Again, though, there is no imminent risk for suicide. Generally speaking, people in residential care are below 85% of their ideal healthy body weight. But now let's talk about the highest level of care, or inpatient treatment. It can also be called medical hospitalization. Again, with this level of care, you live there, so it is 24-hour-a-day care. However, in this case, you are not medically stable. You might need IV fluids or a tube feed, or you might need regular checks on your vitals and labs and stuff. The focus of this level of treatment is getting a patient medically stable, because once they're medically stable, they can go down to a residential treatment where the focus is more on the mental illness itself, not the physical side effects. However, if your inpatient care is at a specialized unit like a psych ward or an ED ward or something like that, then there likely is some sort of mental health programming as well throughout the day. But really, like I said, this is just a step along the way towards residential treatment. At this level, it is not uncommon to see people with poor or very poor motivation to recover. And it is not uncommon to see people who don't get the support they need at home. Meals and snacks, again, are monitored, and tube feedings might be incorporated as well if needed. You are supervised before, during, and after a meal to prevent any sort of behavior that could lead to weight loss or other danger. If somebody is suicidal with intent and a plan, there is a pretty much positive chance that they will be in inpatient care. And then generally speaking, again, these people are below 85% of their ideal healthy body weight, or they recently experienced acute weight decline with food refusal, even if they don't meet that threshold for 85%. And then the last thing I'll say about all levels of treatment is that it is not uncommon for any of these levels to want to monitor your weight and your vitals and other labs potentially as well. At the higher levels of care, they 100% need to be monitoring those things. But anyways, that is my summary of the different levels of care for eating disorder treatment. But remember, everything I said is just a guide. Yes, I got my information from the American Psychiatric Association, which is top tier, but it's just a guide. Every case is different. Each person must be assessed by a licensed professional to determine what level of care best suits their needs. Additionally, I want to mention that other co-occurring disorders might impact what level of care you're at. For example, substance use disorders can impact the level of care you receive. But yeah, that is my summary of the levels of care. I hope that that wasn't too confusing. I know it was a ton of information, but if you have any questions about it, feel free to ask me in the comments. I will answer what I can, but I'm not a professional, like I said, yet. So yeah, I hope you enjoyed this, and let me know if you have any video suggestions down in the comments. Bye guys.